Hello everybody, this is Dr. Tyler Evans from Arete Chiropractic. It has been a minute since I've done a Research Live moment, but I've got a really great paper that just came out a few months ago by a what they call chiropractic biophysics CBP specialist in chiropractic. And so what they specialize and focus on is the curves and global alignment of the spine. And one of the areas that they specialize in is the neck, and it actually developed from an upper cervical chiropractic perspective back in the 60s. And the gentleman that produced this paper by the name of Evan Katz, he did a lot of great work here, and give him, hats off. Great paper. It's called Increase in Cerebral Blood Flow Indicated by Increased Cerebral, Arterial Area and Pixel Intensity on Brain Magnetic Resonance Angiogram Following Correction of Cervical Lordosis. Okay, lots of big words. Basically what it means is they increased the flow of blood to the brain after these corrections to the neck. Now, how does this relate? What is the importance of it? What we know is that when the alignment of the neck, and I'll get my little spine here, so just hang on. We know that when the alignment of the neck is a nice even curve, the blood flows through these arteries up to the brain. They're called vertebral arteries. And a percentage of the blood that goes to your brain goes through the spine. And that can become a problem when the neck is injured in a head or neck whiplash or concussion or mild traumatic brain injury, or even just from repetitive postures. But what can happen is the neck slowly straightens out over time, and what we get is what we call a straightening of the neck, or a military neck, they call it that, or a reverse curve where the neck actually bends forward like this, and we'll actually have a bump in the lower part of the neck. That can become a problem because you see these arteries here, they communicate all this blood flow up to the brain and feed the brain. The brain needs a few things to make it work really well. One is energy and information. The other one is oxygen. And that goes through the blood, as well as nutrients. And so this blood flow is literally like the life fluid or the life force of the brain. It's feeding the brain energy. And so if we have a malfunction in that, if the neck is out of place, it can severely affect how the brain functions. And that can happen slowly over time, or it can happen rapidly in a head or neck injury. So when we look at, like this picture here, you can see how all of these arteries come up into the brain. And then we have this thing it's called the circle of Willis. This guy right here, the circle of Willis. Now this is what feeds the brainstem. The brainstem is the part that controls blood pressure, heart rate, immune function, a lot of the basic functions of our body that we don't normally think about. And that circle of Willis is constantly feeding up to the brain. So in this study, what they did was they did an MRA. Now there's an MRI and an MRA. Now an MRI is a normal magnetic resonance imaging where they put you in an MRI machine, a big magnet, and then the picture's taken. But with MRA, what they do is they inject dye, and the arteries are more visible. And so it's called an angiogram. And so in this study, they actually have these amazing pictures. This is before, and this is, these two are before, and this is after. These two down here are after the study. So after they did the changes to the neck. So you can see, look at this. This is crazy. So this is the circle of Willis in a patient. This is right at the brainstem, right at the base of the neck, right where all the C1, C2, where all the nerves go down from the skull into the spine. Now all these arteries here are light. They're very they're minimal. They're very small. Look at the change after a few weeks of correction to the neck. That is literally lifeblood coming back to the brain. And you can see it more in color here in the red. And so what they actually saw was a 23% to 225% increase in pixel intensity, which just means more image, more color, meaning this area here. This is the pixel intensity, right? So this more increased, more blood flow, basically, to the brain. Now that means a lot of things. One, we know that we have this problem with multiple sclerosis, Parkinson's, Alzheimer's. That's a big thing that a lot of people are dealing with these days, and oftentimes we can connect some of those terrible diseases back to a traumatic head or neck injury, and then a lifetime of all kinds of other things that go along with it. But oftentimes there's a traumatic head or neck injury that can then be the thing that leads to those problems. And we're saying, okay, well, the blood flow isn't getting to the brain, and it's not getting away from the brain because that channel, that pathway is not clear. And it can go along with many other problems, but you can just imagine it's literally choking off the brain slightly over time, on a day-to-day basis. And so getting the neck checked, making sure that the neck is in alignment, is a very important thing to do. Seeing if that neck has a good curve, a nice even curve, and we want to curve this way. So we want to curve this way. That head goes forward, and we see that neck straighten out, right? So we don't want that. We want a good even curve through the neck, right through here. So, if you are questioning, if you have questions, please reach out. Our office is a Retake Chiropractic in Portsmouth, New Hampshire. Our phone number is 603-380-9184, and I'm happy to answer questions over email or phone call. But please, if you have struggled with head or neck injuries in the past and have problems with your neck, you should have your neck checked. Give us a call, and I hope you guys have a great day, and we'll talk to you soon. Bye-bye.